Met. I'm the president for the Rotary Club of Harrisburg, and I invite you to join us for a traditional luncheon meeting, service on a Monday, or Rotary alternate meeting. Everyone's invited, and that means you. Check out our website or Facebook page for more information.
I'm pleased to introduce today Don McKenna, Regional President of Penn State Health, Hampton Medical Center, and Penn State Health Holy Spirit Medical Center. Prior to joining Penn State Health, McKenna has held numerous executive roles, over 30 plus years of healthcare experience. He has led the development of new clinical services, improved access to care, built and purchased hospitals, created ambulatory care sites, and assembled multiple hospitals to create a regional hospital provider network. He has extensive experience in for-profit, not-for-profit, community, and faith-based health systems. He's earned a master's degree in public administration and a bachelor's degree in business administration and marketing from Long Island University in Brookville, New York. It's my pleasure to introduce Don McKenna.
Ryan, mom, dad, phenomenal. Very excited for you and for us for what's going to become in the future. Sean, I was hoping for some walk-up music. It didn't happen. And I got the opportunity to meet several of you at our at the HC, the Hospice of Central Pennsylvania event on Saturday. We got to meet, where's Karen? We got to meet Karen. Never ran so fast in her life. She's a quick walker. So she did a great job. You should be proud as a Rotarian. Doing an introduction and a recognition for one of the award winners. So I have 47 slides, and I will do my best to read each line. And so enjoy it. Don't leave yet, Peggy. Just give me a moment. Okay, so I'm going to operate the slides from here. And any good organization starts with a mission and vision. And our mission at Penn State Health is to care for our patients and people for the well-being, not only in Pennsylvania, but beyond. And our vision is to be the most trusted healthcare provider in Central Pennsylvania. Values. I call them values in practice, and they're called respect, integrity, teamwork, and excellence. And not only do we ask ourselves and our staff to practice those values, but also to make sure we extend it to our patients, their family members, the community, our volunteers and physicians. One of our strategic imperatives at Penn State Health is to transition from what I would call the Hershey Medical Center concept of care to now a community healthcare system. Part of that is through our initiative of 0, 10, 20, 30. And that initiative is to be available for care within 0 minutes or through telehealth. 10 minutes to primary care, 20 minutes to a specialist, and 30 minutes to one of our acute hospitals. But most importantly, ensuring that we provide the care in the right cost, the right place, and the right care at that right place. We serve 29 counties, and we do so with 6 acute care hospitals, over 18,000 employees, 2,400 physicians, 225 clinics, and a variety of joint ventures. Highmark, back in December of 2017, joined with Penn State to create this community network of caring. So they invested in a partnership for $1 billion and have 20% ownership within the Penn State Health system. And that is particularly around the community hospitals. And those hospitals are St. Joseph's in Reading, Pennsylvania, Lancaster Medical Center, our newest hospital in Lancaster, Penn State Health Hampton Medical Center, Holy Spirit Medical Center, and the Community Medical Group. The Community Medical Group started in our first initiative when we began to assemble, and I'll speak to that in a few moments. Assembling, optimizing, and transforming. So as part of our journey, we recognize that we need to assemble those hospitals, those clinics. So we went out, we partnered with Geisinger and took over the responsibility of Holy Spirit. We committed to Geisinger and to the Sisters of Christian Charity to maintain that as a Catholic hospital. That was very important to us and certainly very important to their mission. We developed Hampton Medical Center and Lancaster Medical Centers. we created the community medical group and launched the Blue Choice product with Highmark. In the optimization phase, we consolidated our IT infrastructure, so all of the hospitals are on what we call the Cerner platform. We improved access of care and also expanded our virtual health. Now, as we move to the transforming stage, we want to be more affordable, provide more affordable care. And for the business owners, I think that should resonate well with you, given the increasingly cost and expensive care that we're providing today. And to improve our digital platform, but also develop a differentiated experience of care far beyond what you experience today as a patient or a user of healthcare. So the pandemic, no news to you, but a lot of direct impact to us at Penn State. We had to do so during the pandemic. We had to purchase and integrate Holy Spirit. We opened 2 hospitals. We opened the Lancaster Pediatric Specialty Clinic, which has 21 pediatric specialties coming to 1 clinic within Lancaster. It's taken off wonderfully, really providing the access to care in a local environment. You know, the goal is to make sure that care stays local. That's part of that 0, 10, 20, 30 initiative. By doing so, we're also expanding care in beds at Hershey Medical Center. About 3,000 patients who could be cared for from the West Shore travel to Hershey Medical Center. That was one of the primary reasons that Hampton Medical Center was created, trying to make sure that those patients who need care for the level of care a community hospital should be providing stay in their community, stay in this community. And our volumes have been indicated that we are doing so. The strategic plan that we have is to use the hub and capitalize on the value, the technology and excellence at Hershey Medical Center to support the College of Medicine as they train the future physicians and providers that are going to stay and work in our communities, and work with Highmark to determine services and what's necessary in our community to take care of our patients in the community. Driving systemness, which is opportunities for all of us, again, helping us decrease the cost of care in the community, and also developing standards of approach to how we do and practice clinical care. The Penn State College of Medicine is an integral part of Penn State. There's 1,500 physicians and 1,700 learners. That's medical students, that's allied health physicians, that's nurses, and many other technical clinical employees. We have $150 million of funding for research annually, and we're trying to do some advanced and are being successful in expanding our research, doing some groundbreaking work in cancer, but also in the development of artificial organs. That's something that's very cutting edge, and we're doing that right here in central Pennsylvania. The statistics of 99% of the medical students match. Let me explain what that means. That means of all the doctors, the medical students that are coming out, 99% of them match, which means they've again been accepted to participate in becoming a fellow or a resident or a specialty care provider in one of their top choices. So there's a high demand for the patients, for the students that are coming out of Penn State Health University and their School of Medicine. Now, more locally, there's a 2-hospital strategy that we have in place. And obviously, the 6-mile proximity between Holy Spirit and Hampden is easy for us in how do we manage that organization. When I say easy, meaning from a cost standpoint, it's easier, it's less expensive. So we share leadership across both organizations, not just administration, but also some clinical leaders as well. A little bit about Holy Spirit. Hampden, we opened in October 1st. And on December 1st, we opened up our Women's and Family Center back in 2021. It allowed for us to increase access for Penn State Health care. So patients who are living on the West Shore, not having to go all the way into Hershey to receive the Penn State care they're looking for. As I mentioned, we're extremely busy, which is great. It just tells us and reminds us how on target we were about creating a new hospital for Penn State on the West Shore. We're advancing in technology, robotics, and also patient monitoring systems. Whereas if you're on a heart monitor, instead of it just showing up on a computer screen for somebody to review, it also goes on our staff's phone. So we know immediately there's a connection between the staff member and your heart rate. especially if, obviously, when there's an untoward rhythm. And the clinical services that we're offering is a broad array of medical and surgical specialties. Our women's and babies unit has a level 2 neonatal intensive care unit. We provide inpatient medical, surgical, and intensive care services, and a broad spectrum for ancillary services. 2 months ago, we became certified as a certified stroke center, which is great news for all of us. The incidence of strokes continues to grow, not only in senior population, but also people of our age. And they're very traumatic strokes. They're not simple strokes, they're very traumatic strokes. So having the ability for us to be more available on the West Shore to take care of those stroke patients is essential for all of us. Now at Holy Spirit, we have a trauma center, full emergency room services, and it's the only behavioral health unit on the West Shore. That 31-bed behavioral health unit stays busy and stays full almost every day. Behavioral health services is a key component of Penn State Health. And unfortunately, that's an area that continues to grow. We have a very robust ambulatory or outpatient center setting for our children and for our adults in a variety of different behavioral health conditions. The very large spectrum of medical and surgical services, all aspects of cardiology, which would be open heart, electrophysiology, and interventional cardiology. But in the trauma center, we have the most penetrating traumas in central Pennsylvania. We treat 250 people a year with penetrating traumas. That could be anything from gunshot to knife wounds, et cetera. We are the largest, with a 5th in the state for penetrating traumas. It's not a statistic that we want to be proud of, but we're thankful that Penn State Holy Spirit is there to take care of those trauma patients. We get surveyed every 3 years. Our last survey was last year, or 2021 in December. And we got excellent reviews from the PTSF, which is the Pennsylvania Trauma Foundation system. Our awards are numerous. They're national, they're statewide. Very proud of that. It's our staff that really brings that home for us. We have a great organization, but it's the people that make it work. I was speaking to Sean as he was pulling up my slides. He says that Hamden Hospital is really beautiful. I said, yeah, but it's the people that make it shine. And those 18,000 people truly make the difference. Which leads me to this slide. These are some simple examples, and I say simple because they're routine examples of what our staff do and share their care and compassion. The first was Vicki Bracken. So a patient came into the emergency room after a car accident. She had a child with her. Thankfully, everybody was safe and they had to go home, but they realized that they didn't have the car seat. So one of our employees went out to her car, took the brand new car seat that she just bought for her grandchildren and gave it to that patient. Sight unseen. She didn't share it with anybody. Somebody watched and witnessed and said, Vicki, what are you doing with your car seat? She says, they need it. I don't need it. Which is, to me, again, a sense of care and compassion. It makes me very proud to be a part of an organization. Toby Cohen. So we had a patient in the IMCU, or intensive care unit at Hamden. She was caring for this patient who was homeless. And he was very upset because his locker, or his storage unit, was being foreclosed on, if you will. And they were going to remove all the articles. And those articles were stuff that he got from his mother when she passed. Toby went on her own, went to the storage unit, got whatever she could for that gentleman, and kept him in her house until he was discharged and had a place to put them. And the Lifeline EMT group, they were dealing with an oncology patient that needed repetitive transports. And the patient wasn't feeling well, and they learned that his birthday was the next day. So they outfitted the back of the ambulance in a celebratory birthday fashion. Those are just 3 great examples of the stuff that happens every day from people in our community caring for our community. Some other areas of opportunity in our diversity, equity, and inclusion. Excuse me. We are forward thinking in our area of diversity, equity, inclusion. We have initiatives going around throughout the organization as it deals with multicultural community members. We have a very large Nepalese population in South Central Pennsylvania, which is surprising. I could have considered that on the $64 million question, but also a large Nigerian population and Filipino. So for us, we need to be sensitive to those cultural needs of each of those community members. From the beginning, as we're identifying and holding our leaders accountable all the way to the end in the spectrum of diversity, equity, inclusion, to make sure that we're having dialogue, even the uncomfortable dialogue of how do we interact with people of different cultures. Everything from mannerisms to how you say what you say, even our body language, the impact that may have on a culture that we don't know about, right? So become learning around that. We've used technology. If you're looking for wayfinding signs, we use Google Translator, so you could put your phone up against one of our information signs, ask it to translate to something like Arabic, Nepalese, Spanish. You could pick up 50 different languages and hold it up to that directional sign, and it will convert to you to your language to make sure that you feel more comfortable utilizing Penn State Health. Community outreach, one of our very proud areas of our community outreach is the clinic in Allison Hill. That clinic takes care of a lot of undocumented and minority populations that won't otherwise come to the hospital. It's a nursing clinic that's overseen by one of our physicians. It's been there for a long time. It was started back from the sisters when they first opened up work as they owned and operated the Holy Spirit Medical Center. It's one of our cherished areas, and when we transitioned to Penn State, that was a given that we would continue to do that mission work, that very purposeful work. And the staff there is multicultural. And again, it's a great example. Some of the staff have added specialties and certification in dealing with multicultural community members, and also our partnership with the Latino Hispanic American Community Center as it revolves around education. Other areas, we have the Lion Mobile Clinic. There are 40 nutritional access points across our community for patients and community members who live in food deserts. And we're part of the CDC, the REACH initiative, which is racial and ethnic approaches to community health, in which we try to reduce the racial and ethnic disparities in our communities. It's more than you'd imagine. So for the future, like you, we are struggling with staffing. If there's ever a time today to be an employee, it's today. So we're trying to do different things to recruit and to train. We have partnerships with HAC. We have partnerships with Penn State, working on a partnership with Central Penn, as well as within our own organization to grow our own staff. But we've done something unique, and that's a partnership with an organization called Kinetics USA. We are going to be recruiting, many have already started, 120 nurses from across the globe. Many of them, this is their path. Some very wonderful stories of nurses that have spent 3 years in Qatar or Kuwait or the Philippines or Nigeria, and have made this their calling and picked us. They picked Penn State Health. I can appreciate some are attracted to the faith-based organization. We'll have 100 nurses at Holy Spirit, and we'll have about 40 at Hamden. There's not enough nurses being coming out of our schools, and the tenure, whether it's at the Great Resignation, continues. And COVID did certainly not help that, and a lot of our caregivers have chosen to step away from doing direct patient care. Costs of supplies and pharmaceuticals are out of hand. The adoption of technology and alternative care models are going to happen, not only within our organization, but across the spectrum of patient care, and the telehealth functionality. You know, we use telehealth for stroke patients at both Holy Spirit and Hamden. We use telehealth to help us diagnose and treat for behavioral health patients. We use it for children's care to make sure that we're making the appropriate diagnosis with the Children's Hospital up in Hershey, and continuing to use that now for primary care office visits. So here's the picture of those 6 acute care hospitals that are within Penn State Health. We're very proud of each of them, and they all bring something different to the table when we talk about caring for the community. So thank you for the opportunity to be here.